There is a sensation in your feet that most people learn to ignore. A tingling, a buzzing, sometimes a numbness that comes and goes. Maybe a feeling like something is crawling under the skin, or like the feet are wrapped in something, a thickness, a distance between the sole of your foot and the ground beneath it that was not there a few years ago. You shift positions. You shake the foot out. Sometimes it helps, sometimes it does not. And you file it under the same category where you file most unexplained physical sensations after a certain age. The category of things that probably just happen, things that probably mean nothing, things that are almost certainly just the body getting older and wearing down in the way bodies do. That is the story most people tell themselves. And that story, told quietly and convincingly every time the tingling shows up and then fades away, is one of the most consequential misreadings of the body's most urgent language. Because those sensations in your feet are not random. They are not your imagination. They are not a nuisance to be managed with better shoes or a different sleeping position. They are neurological signals, electrical communications traveling through a system that took decades to build, and that, when it is being damaged, sends exactly the kind of message you have been feeling in your feet and dismissing as nothing. And here is the piece of this that demands your full attention right now. The conditions that cause tingling and numbness in the feet of people over 60 are not benign inconveniences. They include undiagnosed diabetes, peripheral arterial disease, vitamin B12 deficiency severe enough to damage the spinal cord, early kidney disease, hypothyroidism, cervical or lumbar nerve compression, and in rarer but serious cases, the first signs of conditions affecting the central nervous system. Any one of those diagnoses, caught early when the tingling is the only symptom, is manageable and often reversible. Any one of them, left unaddressed for years while the tingling gets explained away, can produce outcomes that change the entire architecture of a person's remaining life. This is exactly the kind of conversation that Dr. Victor Lang built this channel to have, because the tingling in your feet is not a small topic dressed up in dramatic language. It is a topic that deserves to be taken exactly as seriously as the conditions behind it demand. If that resonates with you, hit like and subscribe right now, because the information in this video may be the most directly useful health content you will watch this year. Let us talk about what the nervous system in your feet actually is, because understanding the hardware helps you understand why the signals matter so much. The nerves supplying sensation and motor function to your feet are some of the longest nerve fibers in the entire human body. They originate in the lower spinal cord and travel down through the legs, all the way to the tips of the toes, a distance of 3 to 4 feet in most adults. Long nerve fibers are uniquely vulnerable to certain types of damage because they require enormous metabolic support to maintain their structure and function over such distances. The myelin sheath, the protective coating that insulates the nerve fiber and allows electrical signals to travel rapidly and accurately, must be continuously maintained along the entire length of the nerve. When something interferes with that maintenance, whether it is a metabolic deficiency, a circulatory failure, a toxin, or an inflammatory process, the damage tends to appear first at the farthest ends of the nerve fibers, in the feet and toes, in exactly the place you are feeling what you have been calling just tingling. The first tingling sign that should never be ignored in people over 60 is the pattern of symmetrical tingling and numbness in both feet that begins at the toes and gradually moves upward. This stocking glove distribution, as neurologists call it, where the numbness follows the line of where a sock or glove would sit on the limb, is the classic presentation of peripheral neuropathy, which is nerve damage affecting the peripheral nervous system. And peripheral neuropathy in someone over 60 has a long list of potential causes, almost all of which are more serious than aging, and most of which are treatable when identified early. Diabetes and prediabetes together account for a very large proportion of peripheral neuropathy cases. Chronically elevated blood sugar damages the tiny blood vessels that supply oxygen to the nerve fibers, and it also directly damages the nerves themselves through a process involving the accumulation of sugar-related metabolic byproducts inside the nerve cells. The chilling reality is that many people are living with diabetic peripheral neuropathy before they have ever received a diabetes diagnosis, because the neuropathy can precede the blood sugar elevation reaching the clinical threshold for diabetes. The tingling in their feet is not a complication of known diabetes. It is the first warning that the metabolic derailment has already been running long enough to damage nerves. The second tingling sign that demands serious attention is tingling or numbness, that occurs predominantly in one foot or one specific region of one foot rather than symmetrically in both. Asymmetrical tingling, particularly when it is accompanied by pain that radiates up the leg or into the back, points toward a nerve compression or entrapment rather than a systemic condition. Sciatica, the compression of the sciatic nerve by a herniated lumbar disc or degenerative spinal changes, produces a characteristic pain that travels from the lower back through the buttock and down the back of one leg, sometimes reaching all the way into the foot. But many people experience only the foot component of this nerve irritation, and they explain the tingling and numbness as a foot problem rather than a spine problem. Treating the foot while the compressed nerve in the lumbar spine continues to be irritated produces no lasting relief, and missing the spinal origin delays the treatment that could actually resolve the symptom before the nerve compression progresses to permanent damage. The third sign is tingling and numbness that is specifically worse at night. This nighttime pattern is one of the most clinically informative timing characteristics in peripheral neuropathy evaluation. Diabetic neuropathy is notoriously worse at night, often becoming severe enough to disrupt sleep in people whose daytime symptoms are manageable. The nighttime worsening of neuropathic symptoms is thought to relate in part to the lack of competing sensory input during sleep, when the brain is no longer distracted by visual and proprioceptive inputs from daily activity, and the tingling or burning sensations become dominant in conscious awareness. But it also relates to the circulatory dynamics of lying flat, when the blood flow to the peripheral nerves changes in character. When nighttime tingling is severe enough to wake someone from sleep, when it prevents sleep onset, or when it has been present and progressive over months, it represents a level of nerve involvement that warrants urgent diagnostic evaluation rather than continued patient observation at home. The fourth tingling sign is one that many people experience but rarely describe accurately to their physicians because it does not feel the way they think a medical symptom should feel. It is the sensation of walking on something, a pebble that is not there, a wrinkle in the sock that is not there, a thickness under the ball of the foot or the toes that makes the ground feel different, distant, or padded in a way it should not be. This sensation is called proprioceptive loss, and it reflects damage to the nerve fibers responsible for position sense, the constant unconscious communication between your feet and your brain about where your body is in space, what surface you are standing on, and how to make the micro adjustments that keep you balanced as you walk. When these fibers are damaged, the feet stop sending accurate proprioceptive information to the brain. Balance becomes compromised. The risk of falls increases dramatically, and the person feels it as that strange sensation of not quite trusting the ground under their feet, of having to look down to confirm what their feet should be telling them automatically. In older adults, proprioceptive loss from peripheral neuropathy is one of the leading contributors to fall risk, and falls are one of the leading causes of injury, hospitalization, and loss of independence in people over 65. The strange feeling in the feet is not a nuisance. It is a fall waiting to happen, and it is a nerve injury that needs to be identified and addressed before the balance consequences compound. The fifth tingling sign involves not just sensation, but temperature. Feet that feel burning hot, or feet that feel persistently cold regardless of the ambient temperature, when the sensation does not match the actual thermal state of the foot, represent a dysregulation of the small nerve fibers that govern temperature sensation and that also regulate blood vessel tone in the skin. Small fiber neuropathy, which affects these thin, unmyelinated nerve fibers rather than the larger myelinated fibers that carry touch and vibration, can be missed entirely on standard nerve conduction studies, which are the most common diagnostic test for peripheral neuropathy. A person can have a normal nerve conduction study and still have significant small fiber neuropathy, causing burning pain, temperature distortion, and early autonomic dysfunction in the feet. This matters because small fiber neuropathy is often the earliest manifestation of diabetic and pre-diabetic nerve damage, and missing it because the standard test was normal means missing an opportunity to intervene before the damage extends to the larger fibers and becomes more difficult to address. The sixth tingling sign is tingling or numbness in the feet, accompanied by tingling in the hands, or a progressive weakness that is spreading rather than staying localized. The combination of foot symptoms with hand symptoms in someone over 60 can indicate a systemic condition affecting the peripheral nervous system more broadly, and it can in some cases indicate conditions that require urgent neurological evaluation. Vitamin B12 deficiency is one of the most common and most treatable causes of this pattern, because B12 is essential for the maintenance of the myelin sheath along nerve fibers throughout the entire body. When B12 is severely depleted, which is surprisingly common in older adults, particularly those taking metformin for diabetes or proton pump inhibitors for acid reflux, two medications that directly interfere with B12 absorption, the myelin sheath degenerates. The spinal cord can be affected in a condition called subacute combined degeneration, which produces tingling and weakness in both the upper and lower extremities, with a characteristic difficulty walking and a loss of vibratory sense in the feet that a physician can detect with a simple tuning fork test. B12 deficiency severe enough to cause neurological damage is entirely reversible in its early stages with supplementation. Left untreated, the neurological damage becomes permanent. The tingling that goes on for years while the person takes a different kind of medication or changes their shoes is the window for reversal slowly closing. The seventh tingling sign is perhaps the most commonly dismissed and the most important to name clearly. It is tingling or numbness in the feet that comes on suddenly rather than gradually, particularly when it is accompanied by any asymmetry, meaning it affects one side significantly more than the other, or when it arrives alongside any weakness in the leg, any slurred speech, any sudden headache, any vision change, or any difficulty walking. Sudden onset numbness or tingling in the lower extremities that does not resolve within a few minutes is a potential neurological emergency. It can represent a transient ischemic attack or an early stroke affecting the brain or spinal cord regions that supply sensation to the feet and legs. The asymmetry is the key distinguishing feature here. Chronic progressive neuropathy tends to be symmetrical. Sudden onset asymmetrical tingling or numbness in one limb without a positional explanation in someone with cardiovascular risk factors is a reason to call emergency services, not a reason to wait and see if it resolves. The consequences of waiting are exactly as serious as we discussed in the context of stroke warning signs, because in many cases, that is exactly what is happening. Now let us move into what these signs point toward and what you can do, because this conversation is not meant to produce fear without direction. It is meant to produce action with clarity. If you have been experiencing tingling or numbness in your feet that fits any of the patterns we have described, the first step is the same regardless of which pattern fits. Medical evaluation. Specifically, a visit to a physician with a clear description of when the tingling occurs, how long it has been present, whether it is in both feet or one, whether it is worse at night, whether it is accompanied by any other symptoms, and whether it has changed in character or intensity over time. This description is the foundation of accurate diagnosis, and the more specific you can be about the characteristics of your symptoms, the more efficiently the evaluation can proceed. The diagnostic workup for foot tingling in an older adult typically includes blood tests covering blood sugar and hemoglobin A1C, a complete blood count, kidney function tests, thyroid function, B12 levels, and in some cases a full metabolic panel and inflammatory markers. A nerve conduction study may be ordered to evaluate the large fiber peripheral nerves. In cases where small fiber neuropathy is suspected, a skin punch biopsy, which quantifies the density of small nerve fibers in the skin, is the most accurate diagnostic tool available. If a spinal cause is suspected, imaging of the lumbar or cervical spine may be ordered. If vascular disease is part of the picture, an ankle brachial index test, which compares blood pressure in the ankle to blood pressure in the arm, can identify peripheral arterial disease as a contributing factor. This is not an overwhelming list. It is a checklist that a physician can work through systematically, and in many cases the answer is found quickly once the evaluation begins. What is also true, and what deserves to be said directly, is that many of the conditions behind foot tingling in older adults are genuinely manageable, and in some cases reversible when identified at the stage where tingling is the primary symptom. Diabetic neuropathy stabilizes and sometimes partially improves when blood sugar control is tightened significantly and consistently. B12-related neuropathy reverses with supplementation when caught before permanent damage occurs. Compressive neuropathy from lumbar disc disease can be treated with physical therapy, epidural steroid injections, or in more advanced cases, surgical intervention. Hypothyroid neuropathy resolves with thyroid hormone replacement. The window is the symptom. The tingling is the window, and the people who walk through that window by seeking evaluation while it is still open are the people whose stories end differently from the ones who waited. Your feet have been in contact with the ground beneath you your entire life. They have carried you to every place you have ever gone, through every season, over every kind of terrain, without complaint and without recognition for the extraordinary neurological and biomechanical complexity that makes every step possible. The sensations they are sending you now are not their failure. They are their communication. They are the first vocabulary of a system that is asking for attention, for evaluation, for the intervention that may preserve not just the feeling in your feet, but the balance, the mobility, and the independence that your feet make possible. Do not wait for the tingling to become numbness. Do not wait for the numbness to become weakness. Do not wait for the weakness to become a fall. The window is now, while the signal is still just a signal, and the damage is still in the range where something can be done about it. Tell me in the comments what you have been feeling in your feet and how long you have been dismissing it. Tell me which of these 7 signs you recognized from your own experience. And please share this video with someone you care about who has been living with this and calling it nothing, because the difference between knowing what these sensations mean and not knowing is the difference between acting in time and waiting past the point where acting fully matters. Your feet have been trying to tell you something. Now you know the language they are speaking. The question is what you do next.